Good morning, everybody. Thank you for joining us. I'm Jody Schneider, the president of the FCC and an editor at Bloomberg News here in Hong Kong. This is the fifth of our breakfast briefing series. People have asked me this morning, are we doing more? And we will do more as topics come up, so please feel free to suggest them. We have had sessions. Our first one was on how to effectively and safely cover the protests. We've had one on legal issues. We've had one on technological issues. We did one last week on coverage of suicide and mental health issues. And today's topic is the Hong Kong protests, first aid and health safety. And we're very fortunate to have with us Brian Wong, who's the Senior Staff Officer of the Hong Kong Red Cross, and his colleague Betty Lau. Brian's going to talk to us about some issues involving first aid, what to do if you or those on your team become injured in covering protests or situations like that. He's going to look at how to assess the situation, some detailed information on chemical related injuries from tear gas and pepper spray, which we know sadly have been all too common this summer. What to know about bleeding and fractures, and also environment-related health issues. And he's going to talk to us a little about precautionary steps that journalists can take to protect their health. We'll leave time for questions. We are also live streaming this. Sarah Graham in the back, our wonderful social media editor, is doing that. And we are going to put together all of these sessions on kind of a video resource guide. So please spread the word to people who weren't able to come today, because we want this to be a resource. Let me introduce Brian briefly. He's the Senior Staff Officer for the Hong Kong Red Cross's First Aid Services Coordination Team in the Youth and Volunteer Department. He's a registered nurse specializing in peri-operative nursing and emergency nursing. He joined the Hong Kong Red Cross in 2014. He's been a volunteer of the Hong Kong Red Cross and its overseas medical team since 2013, and interestingly was deployed to the Bangladesh emergency medical operation in 2017 and 2018 to serve people with urgent surgical needs there. So I give you Brian Wong.
Okay, thank you, Jody, and good morning, everyone. It's great for me to see you all here. So today I'm going to talk about the first aid, maybe more practically for your work in the front lines. So before that, I would like to do a little introduction, maybe a very short introduction about the Hong Kong Red Cross. This is what we want. But okay. Sorry, I got one more PowerPoint, but yeah, so I'm sorry. Yeah. Okay. Yeah. Okay, thank you. So, first of all, just some brief background about the Hong Kong Red Cross. We established in 1950, according to the Hong Kong law, Chapter 1129, the Hong Kong Red Cross Ordinance. And actually, what we are doing is to protect human life, to care for the health of vulnerable, and we also promote respect to human dignity as well. So we are the same as the International Red Cross and Red Crescent movement, and we strictly follow the international principle which is humanity, impartiality, neutrality, independency, and we also emphasize for the volunteer service. So maybe sometimes, some days, you will see the first aider on the street, with our vest written with the Hong Kong Red Cross. They're actually the volunteer for our service, and also the unity and universality. Yeah, actually, that's talking about that only one country should have one Red Cross society. Yeah, so before 1997, we are a branch from the British Red Cross, and after that, we are a part of we're the branch of the Red Cross Society of China. Okay, so actually, but what we do for the emergency service in Hong Kong, actually, we have some relief distribution. So in case there is any typhoon or some fire disaster, we will have some relief to distribute to the vulnerable. Okay, we also have a psychological support service, especially for the maybe the incident right now. The people may have some emotion aspects. So this could be very helpful. And we also have a Shall We Talk program that this care about the people, the residents of Hong Kong, if they have any emotion problems. Yeah. And also we have the tracing and the family restoring of family links. Yeah. And the first aid service, and yeah, actually I'm come from the first aid service, and I will give you more information about the practical first aid today. And we also have the hygiene and health promotion, and as I think most of you will know about that, is the blood supply, which we work together with the hospital authority. So another question maybe you may ask how to identify the personnel of Hong Kong Red Cross on field. So this is actually the presentation of our staff and the volunteers on field. You will see there is a very clear emblem of the Red Cross and written with Chinese and English about our agency name, Hong Kong Red Cross. Yeah, for the red, very responsive vest is the first aid team. And the other one, the white one, is the psychological support team. And for all of our equipment and the vehicle, we also have the emblem on our vehicle on that. So you can easily to identify us on the field. So actually, our emergency response since June this year is just start from this to the 9th of June to now. Actually, we provide mainly on the first aid service, the on-site support to the mass gatherings or maybe sometimes an incident on site. And also we have this psychological support service. From the beginning to today, we already mobilized more than 900 volunteers, and we serve more than 1,700 people. And we also provide the training to the public. Just like today, we also have the first aid talk, and we have some psychological support training to the students, to the teachers, and maybe I think if you would like, you can talk about this to Jody, and we can arrange one for you as well. And also we have some public safety training to the media. Last week, maybe 2 weeks ago, we have a training to the Apple Daily, yeah, about the public safety and the first aid tips, and that would be a longer one. We hold for 3 hours, yeah, so you can have some practical session as well. And also we will organize some first aid workshop as well. Okay, so that's actually what we have done in these days. And then, so let's get into the first aid part. So, well, so just maybe in a casual way, you think it's better? Well, I think it's good. Yeah, we can have some chit chat as well. So is there anyone have already taken some first aid training before? Oh, yeah, that's great. Excellent. Yeah, and so that would be very simple for you to get on with this. Okay, actually, we talk about first aid. So what is first aid? Well, first aid actually is some skill, some technical skill that when there is an accident, you can use the resources and the labor on scene to help the injured people to get immediate medical support before the arrival of the medical personnel. That's first aid, very simple. And actually what we are going to do for the first aid is the main one is to preserve life, to save someone's life. That's important. And moreover, we try to take control if there is if the patient got some breathing, they got fracture, we just try to stabilize them to stop their breathing, that which is to prevent worsening of their condition. And also we try our best to promote recovery because sometimes if you use some dirty things or maybe a dirty tissue to cover the wound, that may cause some secondary infection when they arrive to hospital, which is bad for their recovery. So we can just learn some more about how to use this kind of gauze, maybe the correct things for breathing control or other things else. Well, so actually, for everyone, for the layman to the first aider, nurses, doctor, paramedics, we all use the same first aid procedures, actually. So what is that? That would be doctor A, B, C, D, E. Yeah. So if you have the training of the concept of the first aid, so you will be very familiar with that. But it's fine, even if this is your first time to talk, maybe to listen about what is first aid. It is good for you to memorize it. It's very useful tips for you because and not only for the first aid procedure, you can also use this tip to prepare your first aid kit as well. That would be more practical and simple way for you to know about that. So, for the first aid procedure, first of all we talk about the scene safe. But actually, I know you guys working in the front line, that's already is not safe. Maybe you are just in the middle of the protest and the police line. Yes, but for sure you have to bear this in mind as well. Just try to keep yourself safe. If you cannot guarantee that you can stand in a place which is safe, you should have the personal protective gear. But actually, I want to talk about that, but I think after these 3 months, you are already the expert on the personal protective gear. So when you go out, you will have the reflective vest, you got the helmet, you get the mask. Yeah, you also maybe have first aid kit with you as well. So but actually that's really important because if you see there is a fight, maybe a gunshot is already happened and someone is wounded and the police is pushing their line, it's really dangerous for you maybe or for other people who they would like to provide the first aid on scene. Maybe you will become the next victim of that as well. So this is very important that not only the safety, but you have to bear in mind to take care the surrounding, what is going on. And the infection control actually is talking about to wear some protective gear, maybe the gloves. Very simple, just we don't require the surgical glove, but just a glove which can protect you from touching the blood or the body fluid of the patient that can protect you from various of infection disease. Okay, and yep, sure.
Just ask, what kind of gloves do you suggest? That's a good point. Oh, you're going to show us? Okay.
Yeah,
I'm getting
I can
ahead of
show
myself
you.
here. Okay, because I think people are not, I mean, that's not part of what I've seen a lot of people having with them in their gear.
Yeah, maybe some people will ask you to buy the surgical one that is a sterile one. You get open and then put on the hand. But actually, you can just buy a box of latex glove. Yeah, but in case you got the latex allergy, you can buy a nitride gloves. Yeah, that's the color with blue one. And you can actually buy in the pharmacies everywhere in Hong Kong. That's very common. Yeah, and the price is actually pretty cheap. Yeah, that's good for that. Yeah, it's fine. Okay. So after you just make sure that you are safe to touch the patient or to respond that, the other issue you have to check is R. The R means the response. We check whether the patient is awake or unconscious. Yeah, we can simply use the AVPU. to identify if the patient is awake or not, which means A is alert, the patient is oriented, just like every one of us sitting here, looking together, yeah, and having some response when I ask you some question, maybe. Okay, that's great. We already have some good response. The other one, the we is a response to voice. So maybe sometimes you will find a person, maybe an injured person, they are shot, they scared, maybe they injured. Yeah, they are awake, but they lost their consciousness. Maybe they are not able to focus on you and talk to you. You have to shout to the patient, maybe even if you have to ask the patient what is going on, and then they stay focused. I just very painful. Okay, then stay quiet again, and you have to keep talking with the patient. That's the kind that's the degrees of the conscious, and yeah, actually, that would be respond to voice. Yeah, and the other one is the patient maybe just already lie down or sit down. Yeah, but actually they don't have any response. But when you tap the shoulder, maybe you do something to the earlobe. Yeah, maybe some kind of Chinese medicine. They say you just use this technique to, I don't know how to describe this, the upper lip maybe. Yeah, you just apply the force on that, they will, oh, it's painful, oh my God. So they stay focused again and respond, maybe try to move your hand away. But actually, don't do this. Yeah, you know, the teeth will be broken. Yeah, that may be airway obstruction after that. We will talk about that later. Yeah, but yeah, and you will see some emergency doctor or nurses, they will do the rubbing the breastbone. Yeah, and actually this is a good way to test whether the patient is awake or not. But the best way, maybe, you can stimulate the earlobe. Okay, so if the patient is not responsive or unconscious, you just have to help or just ask someone to call the 999. Yeah, in Hong Kong we use the 999. And moreover, for the incident right now, and I think if you find the patient is not awake, and you will see so many people wearing the vest and written that they first aid, they will come and try to help. Yeah, and maybe one circular tips on this is, this that is really remember who they are. So if a police officer fall down, you're not letting them maybe jump to the protester side, or maybe a protester is not going to the police side. They may, yeah, it's difficult to say right now, but this is actually some practical tips on the ground that, yeah, we just try to protect them neutrally and make sure that they would have the best medical treatment for that. Well, and after that, so when this is essential for you to call the 999. Sometimes actually they will the console, they will guide you how to do and what you have to tell them. But basically, the first of all, you call the 999. You have to state that you need the medical assistant, emergency medical service, or you need the police service. This is the first thing you have to tell. After that, if you talk about you want the emergency service, they will direct you to the fire service department console. So after that, the fire console, the fire controller will talk to you about the patient. You have give them the number of patient, the kind of injury, if the patient is awake or not. So they will give you some phone tips on how to handle the patient, and that's important that you have also give your location, yeah, where you are. But sometimes it's hard to say the location because you are working maybe on the road and you don't know what the number is that. But very useful tips is that you can remember the lamppost. Each lamppost, they got an independent number. yeah, you can call the ambulance and tell them the number of the lamppost. So they can check your exact location on the map, and they will send the paramedical service to you. That's good for you. Maybe sometimes you see the self-organized volunteer, maybe self-organized first aid team. They are also confusing how to get an ambulance to there. You can share with them on this information as well. Okay, so after that, we touch the patient, and ABC actually is a life-saving intervention we can do for that. For A is talking about the airway. Whether the airway we means from the nose and the mouth through our trachea to the lung to the air sac, that's all. But always we talk about that is to open the airway, to clear the obstruction, to clear the airway and maintain the airway. So to open it, we will talk about it with some graphic later, and to clear it. So before we clear, we should be clear about that, what is going to obstruct your airway. But usually we got three things can obstruct the airway. One, maybe the fluid, the saliva, maybe blood, maybe sometimes, yeah, blood, yeah, saliva and blood. This is fluid that can obstruct the airway. If the patient is just unconscious and facing in a supreme position. And then sometimes maybe they are eating, they may have some solid obstruction. Yeah, especially you will see some people, they are chewing some jelly on the field. Yeah, maybe some power bar as well. But suddenly they have to escape, and then obstruction may occur. But luckily that hasn't happened yet. Yeah, but you have to maybe know about that. And then the third thing that can obstruct the airway is your tongue. Yeah, the tongue to yourself can obstruct the airway. If you just lost consciousness, you lost the muscle tone, the tongue may fall back and obstruct the airway. Yeah, that can cause some life or death issue on that. So that's why the airway is always important for us. And then the other one is breathing. We have to check if the patient is breathing. It's not difficult actually. Especially is now in summertime, people may have less coughing, so you can just check if there is any chest movement. Yeah, maybe some sound of the breathing as well. You can check about that and to see if there is any ventilation. Is it necessary for us to count how many times the patient breath for 1 minute? Actually, it's not useful in the emergency time. So you just to make sure he got or she got a breathing. That's all. So if the breathing is too fast or too slow, that's another medical issue. But first of all, you have to bear in mind they got breathing. So if they do not have any breathing, we can assume that the patient may lose their blood circulation. They do not have their heartbeat. Maybe very weak on that. So it's important for us to start the chest compression if the patient do not have any breathing, actually. So maybe when you're doing your work, yeah, you will see, yeah, and because for my observation in the front line, the volunteer, the self-organized first aider, actually they're quite young. They may be 14, 15 years old. Yeah, sometimes they scare about the situation and they're not sure about that. Maybe they seek help, but in case you're in the front line, you see the situation, oh my God, the patient is not breathing. Maybe you can remind them, maybe it's a good sign for you to start the chest compression as well. Actually, it did not take any harm to start the CPR whether you're not sure if the breathing is present. Because if the patient still got breathing, but you cannot see that, when you do the compression, actually this is a kind of a pain stimulation. So the patient will awake and try to remove your hand, that's a good sign. But the patient is just keep lying without any reaction, that's good to start the CPR. Yep. So for the circulation, we also talk about the severe breathing. So severe breathing, we means maybe some breathing you can see. Maybe the blood is coming out, the clothes is getting wet. Yeah, this is a kind of sign that severe breathing may happen, and we have to try to do best is to stop the breathing. We don't use much things, maybe, but just some clean gauze. So in my first aid kit, I will have 200 pieces of gauze for that. Yeah, and actually this is good for you if you can have it as well. I know some of you maybe your company will provide you the first aid kit, but maybe some of you don't have that, so you can prepare some for that. So maybe in the last of this sharing, I can talk to you more about in case if you want to prepare for first aid kit. So what can you have on that? Yeah, so I can share that with you after this. So, as we say, the airway, the tongue is one of the things that can obstruct your airway. So I'm not going to talk about that more because I have mentioned it already. And one way to open the airway is by head tilt chin lift. We just open the airway, just putting up like this. Actually, you see this is a very good photo taking, but in practical, yeah, it's hard for you to do just like with two fingers on the chin and just put maybe a hand knife on the head. What we do in hospital or on the field is try best to grab and do this to see after you open the airway if the patient is able to breathe or not. Okay, and after we do that, after the head tilt chin lift, actually we lift the tongue and we open the airway so the patient can breathe about that. Okay, for the breathing, we emphasize on look, listen, and feel. But you will see the first thing I talk about is look, to see if there is any chest movement. Listen and feel is good in classroom, but actually it's not practical for you on site because you know the people will shouting, yeah, maybe the police is coming and it's very noisy around. So very important is to look if the chest is breathing or not. And listen and feel is just maybe sometimes we are in a hall, convention hall, maybe we are just doing something in the room or office. Yeah, you can do that as well. But on the street, that's not possible for you to listen and feel. And we use, actually for tracking the breathing, we use only 5 to 10 seconds on that to see whether it's moved or not. Because some literature review from the American Heart Association is talking about that even for medical personnel, they sometimes took too long time for checking the breathing, which may actually delay the treatment on if the patient got low pulse, we have to start the chest compression, resume the blood flow to the brain and to the heart as soon as possible. But if we delay that too long, they may suffocate for a long time and the brain tissue may die. So that's why we have to help. Okay, so just like I say, if there is no breathing, just start the CPR immediately. But maybe sometimes you heard about you start the CPR with 30 chest compression and then provide 2 rescue breath. Seems quite complicated if you are not trained on that. Very simple. You may just put the hand on the center of the chest, the lower half of the breastbone, and then you just start the compression. That's good enough. You don't have to stop until someone come and take it over. Yeah, the bystander CPR. So for that, we just provide the chest compression and we don't have to give any rescue breath on that. Actually, this could help in case of cardiac arrest. Yep. So you will see maybe the first aider or the paramedic will arrive very soon. So they take over that and then they can give them oxygen and with equipment, the bed mask to give them the rescue breath. Yeah. So for the circulation, we also check for the sign of shock if the patient in shock. And if there is severe breathing, we have to stop that. Okay. So, and, yep.
So,
Yep.
I'd heard that bleeding out is one of the most common ways that people die in these sort of situations, and you have only a limited time to stop that. Could you talk a bit about that?
Actually, what we can do that in the first aid level, we can only apply the gauze to the breathing sites directly with the direct pressure. Put your force on that and try stop the breathing and call for help. Yeah, otherwise it's hard to do because if for those trained paramedic, they will have the tourniquet to put on the maybe up on the single long bone. They can tighten that and stop the breathing. But for first aid level, we don't have that. So what we can do is just use the direct pressure to stop the breathing. And yeah, actually, just like you say, in the international trauma life support standard, yeah, the research also show that most of people may die because of severe breathing, but people do not aware that. Yeah, so that's important. So when we have to do the ABC in the circulation, we also check for if there is any severe breathing. So we stop that, and usually if you find you cannot stop that, just call for help immediately. Yeah, for paramedics, besides the tourniquet, they also have some kind of special dressing that contains some coating agent, can stop breathing as well. So that's why we on site we can do very limited things, but yeah, we have to know that so why we have to, or what time or when we have to call for help on that. Yeah, thank you very much. So for disability and exposed, just maybe for your work you don't have to do that too much, but I can talk just briefly on that. For disability, just see if the patient got some head injury. We will see the pupil size. Is it balanced? Is it react to light? And also we check the AVPU, the alert, if the patient is alert, responds to voice or pain, or the patient is unconscious. So after that, we will try to expose the patient. We will cut off the clothes. Once, if you suspect there is got some wound or fracture, you cannot roll the dress up. So then you have to cut that. Otherwise, but actually before you cut that, you have seek the consent from the patient. Is it okay for me to cut your jeans or something else? Maybe that's very expensive. Yeah, we have the experience. One time we cut that and then patient just keep saying hello to us with the F words all the time, yeah, until the arrival of the ambulance. So really, ask them before you do it. Yeah. Yeah. Yeah, you know, some jeans actually is very expensive. Yeah. Oh my God. Yeah, yeah, sure. So, and now there's the common, so I have to go fast, sorry. Yeah, and nowadays the environment is that we may face some problem is heat exhaustion and heat stroke. Yeah, and you know the weather of Hong Kong, and actually this happen in every time the first aid service in Victoria Park we provide that. But for your information, is 90% of the patient will suffer from the heat exhaustion. That's the excessive breathing and loss of electrolytes. Yeah, but actually we don't have much to do on that. We just ask the patient to take rest, to drink water, maybe some with the electro ions, the tonic water as well. So if the patient got unconscious, we just do the maybe just let them lay down, but take rest as well. And then we use the maybe some fan, the electric fan, maybe some things to make them cooler. Yeah, that's the only thing we can do. But take rest is the most important. But in case there is some heat stroke, the main difference is that the heat exhaustion, you will see the patient is still cool and they got sweating. But for heat stroke, you will see the face is turning red. You will feel the neck. Yeah, this surrounding and the body is going to become very hot, or even they stop sweating. Yeah, that's a sign that is quite important for us to know. If you got the thermometer, when you check, you will see the body temperature is rising, the patient may got some fever on that. That would be a sign that the patient may change the condition from heat exhaustion to stroke. That's important because heat exhaustion is reversible, but for heat stroke, this can cause death, and the death rate is high. Okay, so actually I talked about the main component for identify both of them. So maybe you can also have the PowerPoint for that to see. Okay, the treatment, we talk so many about that, but most important is to take rest, and we hydrate and drink some water. Okay. For heat stroke, we just try to cool down the patient as soon as possible. So what we should have is this kind of things, a towel. You can just shock with some water and make it cool, and then you can just put next to the big artery and axillary and the gone area. Yeah, that can bring the heat away very fast. So this is actually, you can help in the heat stroke case. So, and for heat stroke, you must send the patient to the hospital. Yeah, it is a must. Because in hospital, we will have some IV fluid, and then we will do some medical management on how to control the temperature as well. And for the prevention, just wear the very loose clothes, and then the color should be not in a dark color that absorb heat. And then bring water. You have to drink. So water actually is one of the component in your first aid kit. You don't have to buy very luxury normal saline, and the price now is very expensive. Yeah, just a bottle of water is good enough. Yeah. So special chemical burns, we would talk about maybe the tear gas or the pepper spray. Actually, this is a kind of practical, very small practical that can float on the air. Yeah, and causing swelling, redness, and maybe some skin inflammation. Yeah, and you have more experience than me maybe on that. But for the key and essential first aid management is to, if the patient, they do not get a very good mask, then they react to the tear gas, very simple, just take them away from the tear gas. But before that, you have to see the wind direction. But if the wind direction is go behind me, you're not going to take the patient back as well. Just take them away from the tear gas. Actually, after 15 or 30 minutes, the patient will become they will feel better and the sign and symptom will go on. But before that, what we can do is to use the water to rinse them. Yeah, to rinse with water. So that's why I say you don't have to buy a very necessary normal saline because that's expensive. And the principle for us to remove the tear gas is more practical is to rinse with a large amount of water. So tape water is very good choice for you. You can bring a 1 liter bottle, you can wash for them. In case maybe you can wash for yourself as well. Yeah, but never try to, when you are suffer from the tear gas, never try to open your eyes by the fingers because you may also get some tear gas practical on that. Yeah. And one more important thing is to remind everyone, do not wear contact lenses in the front line because the tear gas particle may stick your contact lens into your eyes. And this would be very hard for the medical personnel to remove that. Yep. So if the patient got any allergy effect or maybe the side effect, skin allergy, maybe shot, actually we don't have much to do on site. We have to try best to take them to the hospital as soon as possible. Yeah, maybe some of you will have the EpiPen, but never apply the EpiPen on that kind of situation because you are difficult to control, and even maybe the clothes will shock with the tear gas particle. So that's not a good idea for you to use that. And yeah, if the patient really with the spray and they suffer from the tear gas, you have to remove the clothes as well and give them a blanket. Maybe for your work, you can also take a zipper bag and put a little clothes inside. So after doing your work, maybe you may just got accidentally sprayed by the tear gas or the pepper spray. You can change that after that. Yeah, that can keep you safe as well. So for difficult breathing, some people may say can use the Ventolin for the patient to relieve the airway, but actually it's not a very good idea because some tear gas particle may still in the residential area, and you try to dilate the bronchi and more tear gas may come inside. That would be a poor effect, maybe not good for them as well. Yep, and there is actually no medical evidence for that the Ventolin is good for treating the tear gas patient on site with the airway problem. So cardiac arrest, as I say, in case there is some problem, it happened, just start the CPR if the patient is unconscious. But if they've just, maybe there is two problem is the angina and the myocardial infarction. The very specific way for you to identify both of them is the angina will go away if the patient stop moving and take rest. But for the myocardial infarction, the pain will not relieve. And it's not a pinpoint pain, it's a crashing pain over the chest. So if the patient complaining, having a crashing pain, yeah, and then they got the difficult breathing and it's a very hard to breathe, that may be a sign of the cardiac arrest. So we do not delay any treatment and just try to call the ambulance as soon as possible. But yeah, but if the patient gone unconscious and then fall with no breathing, so start the chest compression as soon as possible. So for breathing, I also talk about that for severe breathing, just protect with, just save the man with maybe plenty of gauzes. You do the direct pressure, that's already good enough. And then for other first aider or the medical personnel, they will take care of that. So if the patient got, yeah, and never use a tissue for that. Yeah, you know the tissue maybe stick, oh, sorry. the tissue may stick the microfibers in the wound. Actually, you can save his life or her life on scene, but after he or she go to the hospital, that would be another disaster for the patient. Yeah, but just see. Yeah, you have to make your decision on site. Yeah, that I cannot tell you the textbook theory on that. But for the best practice, you have to the essential thing, the gauze, the clean gauze. You don't have to buy a very sterile one, but a clean gauze is essential for your work as well. Yeah, sure. Yeah, okay. Okay. For fracture, we don't have to move the patient. Just stay on ground and wait for the paramedics. Yeah. So, yeah, we cover a lot about that on the fracture, but we are running out of time as well. But the best practice for you to handle the fracture patient is not to move them. Especially for them have the lower limbs or the pelvic fracture. But if they just got the upper limb and they can walk or run, just ask them to run away from the conflict area so they can wait for the medical assistant safely. So, and this is the last of my PowerPoint. This is quite important that this is an international logo for the first aid. So actually that is not the red cross, but this one. So, and this is important, and you can disseminate this for us if you see they got the red cross as well. Okay, so thanks about the sharing today in a very hurried time. And yeah, and actually yeah, sure. I can show you the kit.
And are these things you would suggest that people who are on the front lines carry with them in their
Yeah.
backpacks?
Actually, I say for the dangerous, for the D, you can protect yourself with the glove, maybe some latex glove or maybe some nitride gloves. And sometimes maybe you cannot see things very clear. You can have the light to see the wound, especially for the light time. And this one, I don't think is good, but actually this work, in case you run out of battery, you can just do the mechanical generator with your muscle. And then the other important things you have to have is maybe the gauze. This is some luxury gauze, and this is the triple one. Yeah, but actually they're the same for the first aid. For sure, if you go into the operation theater, this is not for that. Must be this one. But for first aid, the wound is dirty, maybe with so many the surrounding duct, or maybe even the I don't know how to say, but something dirty, even dirty than this gauze. So we have to use that. And maybe you can have some triangular bandage and the roller bandage. You can help. And you may have some normal saline, but this is expensive as well. So I would prefer you to have a 1 liter bottle of water. Yeah, that's actually quite cheap, and you can buy from the convenience shop. But you will see for the ordinary or maybe for a better first aid kit, we will have a different kind and different shape of gauze that you can apply for the patient. But if you're not going to buy a very luxury one, we can actually just prepare for the basic equipment on that. And this one is the space blanket for the patient who suffer from the hypothermia. Yeah, actually, it happens in Hong Kong, even in summertime. So if you remember, 18th of August, people gather, they have a mass gathering in Victoria Park, but we have a ferry just bringing dogs and cats. And then this would be helpful, yeah, because they got all wet and then they just become some hypothermia cases, and still we have to use this one to keep them warm. And this one is good. This is the instant cool pad. You can just open that with a punch, and then actually there is two kind of chemical inside, and then they will become very cold. This is good for you to do the maybe the heat stroke case. You have to cool the patient down. You can put here, and then in the axillary area, and also if the patient got fracture, this is the cold agent actually can make it as a pain relief as well. Yeah, and very important, maybe you have to have a tape. And then also with the forceps and the scissors, yeah, can help you to remove some dirt on the wound, or maybe sometimes you can use this to cut the gauze as well. So actually, if you're interested in the first aid kit, you can contact me after the meeting. Yeah, we can still have this in records. But for practical, I will told you 5 things that you should have as a first aid kit. The first one is with the headlamp. Yeah, it's good for you to work at night time, and a face shield. In case there is a CPR case, yeah, you have to protect yourself if you are going to provide rescue breath. This is a barrier for you and between the patient, so protect you from infection. But if you find, maybe you can do the direct mouth-to-mouth CPR as well. But it's good for you because of the infection control. Okay, the headlamp, the pocket mask. Okay. The towel, this we can use as so many things, but at least you can cool the patient down to make their sweat away, something like that. And the gauze is very important. Yeah, you can have it. And this one, I think maybe most of you will have in your working case that is a duct tape, especially for someone holding the camera. Yeah, this can serve as a tape. And this can also make as a, maybe a stabilizer as well, if the patient got injured. But we are running out of time. But you can actually, we can have another section maybe later to have a practical session how to use this one. But very simple, if the patient got breathing, you apply the gauze and then you just stick on that. That would be nice. You already saved someone. But yeah, you know, for men that would be horrible. But that happened in hospital. It's fine. Yeah, and actually this can, yeah, we can use this to make a sling for the arm as well. Yeah. And this is, yeah, actually quite important for you. And last one, 1, 2, 3, 4, 5. Okay, sorry, it's 6. The bottle of water. Yeah, you don't have to again and again. Don't buy very necessary normal saline. We don't have that. But actually, there were tons of the normal saline on the front line. You may take some everywhere. But for your work, maybe you can have never use the glass. Just the plastic bottle is fine. Yeah, you can rinse the wound. You can rinse the patient with the tear gas, maybe pepper spray, everything you can use with the water. And then use the gauze to rinse that, to dry the wound, to cover the wound, to stop the bleeding. So actually this 6 thing is already good enough for you to prepare for first aid kit. But for sure, if you want a better one, we can still show you about that after this section. Okay, thank you. Yeah, sorry for taking so long for that.
No, we have time for a few questions. Any obviously detailed things, and Brian can show people the kit if you want to stop up afterwards. But any questions that would be useful for the group in general? And please identify yourself and your affiliation if you would too. Thank you.
Brian, thanks very much. I'm Bernard Murphy. I'm an associate member. I'm also with the healthcare team of a firm called Howes Williams. So very interested in your talk. The question I have is, during the protest, does the Red Cross, how do you organize deployment of volunteers? And how many volunteers do you need for any particular protest? Thank you, that's it.
Well, for the Red Cross, actually we start our, how we respond is the first step is we have someone to contact us. We have an organizer, to apply for the first aid service. Okay, after that we will start the recruitment for the first aiders. Actually, we have 500 first aider, for the whole first aid service, and actually we have already deployed the volunteer times about 500 and 1,500 times already. And we start the first aid service on 9th of June. And actually, in most of circumstances or most occasions, you will see the Red Cross maybe on the street. Actually, on the street, we must have the organizer just like the organizer in Victoria Park, they have the mass, the public order event or the rally, and then some of them are our community partners of the shopping in the shopping malls. Okay, so if they see there may be a potential of mass gathering around the shopping mall, they will invite us to provide an emergency first aid service as well.
Thank you. Hilda.
Just out of curiosity, for the protests that are not approved by the police, does the Red Cross still send volunteers or not?
Well, thank you for your question. Actually, as I mentioned, if the police is prohibited the gathering, actually we are not allowed in that area as well. But we will maybe this. But however, the shopping mall, maybe the shopping plaza, this is the private place. They will see if there may be a mass gathering, or maybe the people will evacuate into the shopping mall that they have the medical need. So in this circumstance, we will send the first aid team for the shopping mall, but not for the protest.
Time for one more question. Okay, well, Brian and Betty will be here for a bit, and I'm sure would be happy to answer individual questions. Please join me in thanking them. This was very useful.